So I think that one of the important and unexplored issues in climate change and health is the long-term impact of some of the events that are occurring to children, and not only what it may mean for their health today and their physical and their mental health today, but what it may mean for their health over their lifespan. And within pediatrics over the last 25 years or so, we've learned a lot about what are called adverse childhood events. And one of the individuals who knows quite a bit about adverse childhood events is Dr. Erwin Redlener, who's President Emeritus and co-founder of the Children's Health Fund, and a philanthropic initiative created to deliver high-quality care to 25 of the nation's most medically underserved urban and rural communities. Dr. Redlener is also founder and director of the National Center for Disaster Preparedness at Columbia University, professor of health policy and management at Columbia's Mailman School of Public Health, and also in pediatrics at the medical school. We're going to have two distinguished commentators after Dr. Redlener is finished. You've already met Dr. Carissa Alman, board-certified community psychiatrist and assistant professor in the College of Medicine at Florida International University in Miami, Florida. She mentioned her relationship with Creer Con Salud,
Create with Health,
nonprofit of Puerto Rican psychiatrists in the U.S. focused on mental health awareness and disaster response efforts in Puerto Rico. And then Claude Tellis, a pulmonary critical care and sleep medicine physician, both in the Ochsner Clinic in Baton Rouge, Louisiana, and in the U.S. Army. He's retired from both of those positions now, but had quite a long and distinguished career. He's a fellow of the American College of Physicians and the American College of Chest Physicians, and we've had a theme running through this morning with a lot of individuals from the National Medical Association, very strong supporter of the coalition, and Dr. Tellis is a member of the National Medical Association Commission on Environmental Health. So I'll turn it over to you, Dr. Redlener, and we'll move on from there. Erwin, please go ahead.
Well, thank you so much, Jerry, and good morning, everyone. And really appreciate an opportunity to be with you, even though it's not in person. I think this digital alternative is going to be fine, hopefully. And I'd like to look forward to sharing some thoughts about the issues of climate change as it relates to children, and particularly, can we look at climate change as a generator of a very specific kind of adverse childhood experience and the resulting toxic stress, which can have all of the long-term effects that I think so many of us are already familiar with. Before I get started, though, I do want to give you a little bit of background about our National Center here for Disaster Preparedness and the kinds of things that we're concerned about, because that will lead me to hopefully to share some thoughts with you about climate change and what it means for children and the long-term prospects for negatively affecting the health and mental health of children as they grow into adulthood. So let me begin, first of all, just a couple of words about Jonathan can help me with the advancing on this. A couple of words about what the National Center for Disaster Preparedness is. And it is an entity, as Jerry mentioned earlier, that we established in 2003. And the purpose, it's kind of an academic think tank, but we hope to understand and improve the nation's capacity to prepare for and respond to and then recover from disasters, especially very large-scale disasters, which we refer to as megadisasters. The National Center focuses on system readiness, our emergency response systems, our recovery systems, our child-serving institutions. Are they resilient? Are they prepared? And hospital health systems, what needs to happen to make sure that they're optimally ready to respond to whatever kind of major disaster may come our way. And there's been plenty of major disasters since we started this center back in 2003, which we're going to get to a couple of those in a minute. The recovery issue, which I'm going to talk about with respect to complications from climate change, is something that we're not doing a very good job at. I'm going to mention a little bit more about that when we come to it. And I think what we're seeing in Puerto Rico, unfortunately, is going to be a very good example of the problems and challenges we face in trying to do recovery properly. And I must say that even in Texas, after Hurricane Harvey last summer, we're still struggling with the recovery efforts in that part of our country as well. We spent some time thinking about citizens and the public. How ready are you and I and our families and our communities and our neighbors? Are we personally prepared for disasters? And unfortunately, very few Americans actually are. I'm not sure the redliners are all that well prepared either, but we are trying. And but if you think about that, that's a big challenge for us to deal with, because citizens are actually the first responders when it comes down to trying to deal with it with a major event that's just happened. We focus a lot on vulnerable populations with a particular focus on children. I'm going to tell you how we do that, and then we do a lot of education and technical support around all sorts of issues involving preparing for, preventing, and responding to and recovering from disasters. Some examples of projects that we are focused on, have been doing, or have done already in the past. I'm not going to detail all these, but I did highlight some of the programs that we've focused on with respect to children and pediatric readiness. We've held a number of pediatric consensus conferences over the years to look at the areas where there's no evidence to provide a strong base of what we need to do about certain kinds of medical countermeasures, for instance. So in lieu of evidence or research, there may still be reason to have to make decisions, and we've tried to bring together experts to talk about those areas for which there's not sufficient research, but we need to have some kind of conclusion about, for example, the dose of doxycycline or Cipro for a small infant exposed to anthrax, even though there's not much research there. We've looked at children as targets of terrorism. We've looked at school readiness in New York City and other places in terms of shooter events and potential terrorist acts. And then we've looked at how children fare in disasters during the recovery phase. And then we're currently involved in a fairly large project looking at the resilience of child-serving institutions. We're looking at communities in Putnam County, New York, and Washington County in Arkansas. One thing I want to say, and this is germane to what's going to follow here, but our center is not particularly worried about the country's ability to deal with large emergencies or small disasters. What we are mostly focused on and most concerned about are what we call mega disasters. And mega disasters are very large-scale events, catastrophic events with lots of very serious consequences that, regardless of cause, whether it's terrorism or a natural disaster or something else, whatever the cause is, a mega disaster is defined by the reality of an event overcoming local capacity to deal with it. And the particular indicators for a mega disaster are, first of all, the inability to manage the immediate rescue of endangered survivors of whatever the event is. And secondly, if we are able to rescue people, are we able to provide the care that's needed immediately and longer term? And if those two are not within the capacity of local authorities and capabilities, then outside resources have to come in to help make sure that we've done as much as we can to help actual survival. Another factor of mega disasters is our inability, and these are in priority order, obviously, But the third priority would be our ability or lack thereof to protect vital infrastructure or large amounts of property destruction, and then the possibility of societal breakdown, which actually doesn't happen very often. So these are the characteristics of what we see as mega disasters, and as we'll see later, climate change is capable of producing very large-scale disasters, which can have consequences that are very long-term. This is a map of the United States that more or less generally outlines areas of particular kinds of risk, from volcanoes and earthquakes to coastal storms and so on. And every part of the country has a potential propensity to be affected by a mega disaster, and some parts of the country are better prepared than others. But overall, we are dealing with a situation that makes us conclude that America is not really prepared for large-scale disasters. And there's a number of reasons and why we make that statement. And one of them, first one, has to do with a very important diminution of resources and funding that comes from the federal government. For example, the hospital preparedness program has been cut by more than 50% since it was instituted about 12 years ago. Public health preparedness in public health agencies also is dramatically underfunded at this point. At least 90% of Americans, as I was indicating before, are not prepared in the basics, food and water for several days, crank radios, batteries, etc. All those things which are repeated over and over again by agencies like FEMA or NGOs like the Red Cross. Hardly any of us are actually prepared in terms of those kinds of criteria. People with particular vulnerabilities, which include children, the elderly, people with disabilities or chronic illness, are hardly ever sufficiently paid attention to in disaster planning, and that's another really big problem. And as the mega disaster is increasingly larger in scope, we are increasingly less capable. So the bigger the disaster, the less prepared we are to mitigate, respond to, or recover from these disasters. And speaking of recovery, we simply cannot do recovery. We have not figured out, after all these many years of large-scale disasters, how to do recovery. And that is dramatically the case, as I said, in Texas post-Harvey. And now we're watching this very painful, inadequate recovery that's going to take at least 5 to 10 years in Puerto Rico after Hurricane Maria that happened last September. And the other sort of dramatically important observation we've made is that we don't really learn very well from our experience with disasters in the past, and we don't figure out what the real lessons are, and we especially don't figure out how to apply those lessons that we have learned. So we have the experience, we have the lesson, and very little lessons that are actually applied to fixing the situation for the next occurrence. The other point about mega disasters, they are cascading events, and I want to give you an example of one in particular that is actually germane to our conversation here. First one is the pandemic flu, and pandemic flu has certain assumptions that go with it. You may be familiar with this, but I'm going to take New York City as an example. New York City's got a population currently of about 8.2 million. If we had a pandemic flu, let's say the H5N1 variety, the attack rate is 30%, meaning that 30% of that 8.2 million will get pandemic flu virus. They may have very mild or almost invisible symptoms, but they also may have very severe consequences, which we'll mention. 10% of people affected will have to be hospitalized. 2.5% of those infected will not survive. And what this means in terms of actual numbers, let's say, and we're going to stick to New York here, that means that 2.4 million people in New York City will contract the H5N1 virus. That would include 600,000 children that would be infected with avian flu. 60,000 people would die in New York, which includes 15,000 children and 200,000 hospitalizations. And we will not have in New York, no matter what we do, let's say something happened, if we have this flu, there's nothing we could do to make sure we had enough vaccine, antiviral meds, hospital beds, ventilators, et cetera. So the actual medical response that would be needed is already inadequate and would not be able to cope with this amount of consequences. We're just seeing the above slide and the above data points. But the big thing in terms of the cascade of consequences from pandemic flu is that schools would be closed in order to help reduce the transmission of the virus. Parents would be sick. There would be quarantines. The economy would be in trouble because the workforce would be staying home, caring for their children. There would be little assistance from the outside since we're dealing with the pandemic. And all the other communities that we might go to for help in an isolated event, in a pandemic, they themselves would be struggling to meet their own needs. And then lots of bioethical and legal issues and so on that I'm not going to go into here, but it's the pandemic flu and the medical consequences, then big time societal disruption that will affect families and so on. So the questions are, would a major pandemic be considered a toxic stressor? That is, stress on children over a long period of time, producing all of these stress hormones and the long-term consequences that occur from that. And for that matter, what about other disasters? Should any major disaster, any mega disaster, be considered a toxic stressor? And we think the answer is yes to both of those questions. And especially if there's pre-existing conditions like poverty or isolation, that if you add to that a mega disaster in those communities, we automatically are setting ourselves up for all of the children affected by this disaster really having an adverse childhood experience, an ACE, which leads to toxic stress, which leads to all the consequences that we're all hopefully familiar with. So adverse childhood experiences leading to toxic stress, leading to release of stress hormones over a long period of time in a sustained way. That leads to physiological and brain architectural changes with long-term health risks, which include both chronic medical conditions as adults and a very big increase in psychological and behavioral problems in children, long-term and short-term. So all of this is making the case that that a mega disaster itself is an adverse childhood experience, and that adverse childhood experience leads to this chain of events that we're familiar with. There are certain things, 3 things I want to mention that can exacerbate the stress associated with disasters. And the first is if the population has to evacuate or is displaced. And here's where we're starting to think about the issues with climate change. As the planet warms and sea levels rise, there may be wholesale need to displace coastal populations somewhere. And that displacement and the evacuation of populations is itself a very major exacerbating factor for a disaster that can lead to ACEs or toxic stress. The second exacerbating factor is the recovery process. I've already referred to the fact that we don't do recovery well, and the longer the recovery is stretched out, the longer it takes to return to some level of normalcy, especially for children, the more difficult and the more exacerbated is the stress associated with disasters. And the third thing that happens during large-scale disasters is disrupted family dynamics. And I want to say a couple words about that. The first thing is that probably have not heard much about this before, but I just want to tell you that evacuation of a population for whatever cause, a natural disaster, terrorism event, a meltdown of a nuclear power plant, when people have to evacuate, whether it's from any of those causes or any causes associated, say, with climate change, people get separated from loved ones. There's an extreme uncertainty about when they'll be able to return to their home communities, if ever. And that uncertainty is obviously a major psychological problem for people involved in having to be displaced. This disruption of normalcy and routines is extremely important in terms of child psychological stability and other factors which we'll get into. People they're leaving behind, or they've lost possessions, they lose pets, they're hungry, they're thirsty. There's trauma associated with the evacuation process itself, including motor vehicle accidents en route, acute illnesses, chronic issues, et cetera, and a very difficult situation for most people that we haven't really studied sufficiently, but these are the issues that make me say that evacuation and displacement is a major problem for people. This issue about prolonged recovery, I'm looking here at, you're looking at a slide that has at the top the acute flooding that came from Hurricane Katrina, 2005, and below it is an image of something called Renaissance Village, where people recovering, waiting for recovery, were placed in these very difficult environments. These are FEMA trailers that people had to stay in with families. These are 200 square foot temporary homes that people had to stay with their children, very isolated from their place of employment, from schools, from medical care, and so on. And people stayed from a year to a year and a half in these situations, and clearly a very, very stressful situation. We did some long-term follow-up of a cohort of 1,000 children that were impacted by Katrina, and you can see the data here. This cohort, which we looked at, I guess 5 times or 4 times over a period of 5 years. But these children were 4.5 times more likely to have symptoms consistent with serious emotional disturbance. The parents who thought their children needed professional help for whatever problems they were experiencing, more than half did actually not get the help the parents thought they needed. And there were all kinds of academic consequences that I'm just highlighting here, that 1/3 of middle or high school age children were 1 or more years older than appropriate for their grade in school. So there were all kinds of academic problems as well as health and emotional problems that these children were experiencing. So we had a long, difficult recovery and consequences that we were able to measure. And finally, the third issue is the disrupted family dynamics. People are not working. Let's say during recovery, they can't get to their jobs, or there's no opportunity to replace those jobs. This causes all kinds of stress in families, and this is just some data from the National Center for PTSD in the U.S. Department of Veterans Affairs. And you can see here that very big increases in PTSD and domestic violence and so on, all of which, of course, are ACEs for children in these families whose dynamics were very much disrupted by the disaster. So in terms of climate change and the risk to children, so first of all, climate change, let's just say on a macro level, is producing a warmer planet with the possibility of much more frequent droughts, and the forest fires and wildfires that we've seen over the last few years, increased intensity of coastal storms, and probably, although this is not established entirely, the increased frequency in addition to increased intensity. Intensity, we could say, that's pretty much decided, that we do have very significant increases in the intensity of coastal storms and maybe the frequency. We have rising sea levels, which affects, of course, all the coastal regions. There was an incredible article that I referred to by Elizabeth Colbert in the New Yorker a couple of years ago, which basically outlines the danger in Florida. Miami is inevitably going to disappear, according to data that we know now, and Tampa and other coastal cities in Florida are at extreme risk from rising sea levels and other factors. And then all kinds of disease vector changes that will come from a warming planet and changes in water tables and all sorts of other realities that are going to affect the ecology of disease vectors. So all of those things will cause the human consequences, human impacts that you may be familiar with, but just to delineate some of these here, that the increased megadisaster exposures that may come from, that will be coming from climate change, will have the same problems with recovery from those disasters as we've seen in the past, and more so. Economic instability, community and family, within the community and within the family, cause a tremendous stress within the family. The non-voluntary migration internally and externally, either people out of their homes and moving to some temporary shelters within their region where they did live, or being actually displaced to some very distant parts, distances significant from where their original communities were. Psychological stress, disconnect from support systems, and increased likelihood of infectious diseases. Special concerns for children, With planetary warming, there will be increase in ozone levels in the environment, as well as other environmental air quality pollutants, with increased incidence and intensity of asthma, a particularly important problem for children, especially low-income children. The disease vector ecology changes that we talked about have the possibility of increasing the exposure and vulnerability to a whole range of infections, including mosquito-borne infections. And I want to point out particularly that we already feel pretty confident that things like the season for Zika virus would be extended, and Zika becomes a much bigger problem, along with these other potential infectious diseases with the warming planet. And then the exposure to natural disasters related to climate change, followed by displacement and difficult recovery and domestic stress, are all major adverse childhood experiences. So I'd like to stop there, and I don't know whether, are we getting this, Jonathan, we're going to be able to do Q&As, or if there's any questions, but I guess we have commentators that are going to comment, and I'm going to put on these headphones.
So we're going to move to our two commentators here, and I need to ask them please to be very concise with their remarks. While we get Dr. Tellis' slides up, I'll ask Dr. Aleman to make her remarks.
Okay. So I have some comments about the part where Dr. Reitlinger mentioned returning to normalcy. There's some research studies and some investigators that are looking into a concept of resilience that goes a little bit beyond just going back to normal. When we think about underserved and isolated communities that have been racially or systemically oppressed, returning to normal might not be enough because they were already put into very vulnerable positions in which they're not really prone to be ready for a hurricane or for a disaster that has to do with climate change. So the concept of transformational resilience has been very helpful for us in our work in Puerto Rico, and also has been used in a couple of projects that I've been involved in Florida. And it's basically going a little bit beyond just disaster preparedness, thinking about planning for long term, involving the community, giving a voice to persons or communities that have no voice, thinking about sustainable development initiatives, and thinking about the whole community and an ongoing process, not just to solve the crisis and then forget it, which is unfortunately what we're seeing a lot of in the South and in Puerto Rico. So I just wanted to mention that I literally, when we've gone to community leaders, we literally bring them the slides. This is actually based on research from the RAND Corporation. You might want to look that up. They have models on building resilient communities and online trainings that are for free. A lot of work has been done by Dr. Anita Chandri, I believe is her name, Chandra. So if you want to look that up, it's very interesting. I thought of resilience in a very different way before looking into that work. I also wanted to mention with the situation in Puerto Rico, I'm not a child psychiatrist, but in the community work that I've done there, we've definitely seen the impact on children and the impact on the teachers. We're undergoing a situation with our fiscal crisis where there is a process of the government attempting to privatize schools, and there are a lot of difficulties that the teachers are going through. They were one of the main responders to really get their schools in shape to open them up. And there are a lot of discrepancies with government actions and what the teachers want for their students. So the first training I did in Puerto Rico was in an alternative school that works with at-risk youth. And the teachers were dealing with, they were psychologists and psychiatrists without any training. They were dealing with situations that were very complicated, not only with their students, but also with their parents, students that were getting there without any meals, getting to the schools without much resources, parents that were trying to work with them to really get back into track after some of them losing everything. So there's a process to privatize the schools right now. They're closing 238 schools to cut funds and to pay back the debt that Puerto Rico has, and then the Secretary of Education gets $250K per year, more than the Secretary of Education of the US. So in terms of the social determinants and addressing how politics and how things like, for example, disaster capitalism influence our ability to work with the health of communities that have been affected by climate change. We just can't ignore all of these factors because then we're not going to really be successful. So I just wanted to mention that. And in Miami, there's a great project that I'm aware of that I wanted to mention just to end on a hopeful note. It's called the Florida Disaster Resilience Initiative. And there's a lot of resilience groups in Miami funded partially by government and some that are nonprofits. This one is particularly focused on displaced communities and communities of color that are around the famous areas of Miami and Miami Beach that are facing the consequences of climate change on an everyday basis without much support. So they're going to work on community empowerment projects and training certain community leaders in the same sense that we think about in our field in mental health with peer support and peer recovery. They're using something similar to really empower them to speak up and defend the rights of their communities to have more support to prepare. So I wanted to end with that.
Good morning. Still morning, isn't it? As a discussant, I'm going to be a little bit of an oddball since I've got some slides here to show you. My presentation has to do with more of an on-the-ground account of what happens during a disaster. I'm from Baton Rouge, Louisiana. How do I change this? Okay, so, what we had in Baton Rouge in 2016 was an unnamed rainstorm. And so what I was asked to do was to talk to you about what went on and what happened after the storm. This is Baton Rouge. We're right on the Mississippi River, about 80 miles northwest of New Orleans. Our average rainfall is about 61 inches. So we're basically inundated with rain anyway. But this was a little bit different. On Thursday, August the 11th, as I have here, the rain started. My wife was going to a meeting in the evening on Thursday evening. They got about 20 miles down the road. The rain was coming down in sheets, and they turned around. That was the beginning. We were told that this might be this was going to be a significant rainstorm, but it was unlikely to be a 1 in 1,000 year storm, but it did turn out to be a 1 in 1,000 year storm. And you can see the dark blue bullseye there, just a little bit north and east of Baton Rouge, was the concentration of the rainfall. So at the outset, it was thought to be felt to be a storm that was the most catastrophic since Superstorm Sandy. 20 inches of rain fell within hours. We had a declared emergency. Coast Guard rescued, and others rescued about 20,000 people. 8,000 went to shelters, and we needed quite a bit of aid. In retrospect, yes, it was a massive rain. It did come down at 2 to 3 inches per hour. It was a 1,000-year flood. Up to 31 inches of rain fell in some areas. And that's over time, that was about 7.1 trillion gallons of water. Hurricane Katrina, by contrast, was 2.1 trillion gallons of water. So this is enough water to fill. I don't know if anybody's been to New Orleans, but if you know Lake Pontchartrain, it's about 40 miles in length and 24 miles in width. And so this was how much rain fell. Now, of course, Texas always wants to be the largest of everything. And so where do they come up with Hurricane Harvey? And we know that they had 51, almost 52 inches of rain, 33 trillion gallons of water. So it pretty much dwarfed us. And, of course, they're in the middle of the recovery period for that. But for us in 2016, that 30 inches of rainfall in that particular month of August dwarfed any other rainfall that we had, any other monthly period of rainfall that we had going back to 1907. And of course, as you would expect, it was life-threatening. You can see that there's water everywhere. This is near my neighborhood, and just to give you an idea, there was water everywhere. from the east to the west, mostly in the northeast. It flooded about 20 to 21 parishes. That's counties and anybody else's speak. So from the Mississippi border, almost over to Texas, to an area called Lake Charles. Rescues were done by the Coast Guard, but many rescues also were done by what people know now as the Cajun Navy, which is basically everybody who has a boat gets out and starts to rescue folks. I don't have a boat, but I'm thinking of getting one. This is my neighborhood. The water crested. The rain really stopped. It started about Thursday. It stopped about sometime Saturday. And the Amite River, which is sort of right behind my house, crested sometime late Saturday, early Sunday. This is early Sunday morning. This is around the corner from my house. The water, there's a lake and a river and a stream down past there. It came up, flooded all the houses below. My house was going to be next. So, you can't imagine, or maybe some of you can if you've ever been in anything like this, the anxiety that you have when you're told to shelter in place. It's not too easy to do, but people who didn't shelter in place got stuck on the road. Interstate 10 was closed, Interstate 12 was closed, there was water everywhere. Thousands of families took shelter, were taken to shelters, and of course that includes the children. The slide here also shows the mold that appeared almost right away in folks' houses. So the impact was 13 deaths. Over 8,000 people were taken to shelters. There were many more thousands rescued. And you can read there, 20,000 businesses were disrupted and 92,000 homes. And the estimates are all over the place. These are the most recent estimates, but the initial estimates were 150,000 businesses and homes were destroyed. I don't think we're ever going to really know what the accurate numbers are. And so what happened with children and folks? They left their homes without clothes, without medicines, no transportation, no shelter. There were health issues that occurred. One of my volunteer jobs is with a group called Together Baton Rouge. We got together and took phone calls from folks, and the phone calls were from people who wanted to get their medicines. So we had to refer them to pharmacies that were open so that they could get medicines. But the biggest thing was stress, anxiety, depression. There was a small uptick in the West Nile virus, but that did not turn out to be anything that persisted. The thing that really breaks your heart is to see this. Folks with the belongings out on the street. This is taken, I was driving around, so this is my car, and I'm just taking pictures of people in my neighborhood putting their belongings out. This is President Obama, who came down about 3 weeks later, just north of Baton Rouge, visiting some of the communities in the area. A year later, still people are gutting their homes. So some people didn't gut their homes right away. I don't know where they went. They lived in their homes. They lived in motels. They came back, and 1 year later, September, they're still trying to get their homes back. So the point about long recovery time is actually true. We still have people who are living in motels and not back, and this is children also. So looking back, we can see the magnitude of the problem. It was large, but still unclear. When I talked to practitioners and pharmacies, they filled a lot of prescriptions. There were very few cases of asthma, although there were some in the children. One of the pediatricians I talked to said they thought it was due to mold. They did note, the practitioners noticed a decrease in visits. Of course, you know that they would notice that. Schools were closed for a few weeks, but they wanted to reopen them as soon as possible. One of the reasons is that many of the kids are underserved, and one of the meals that they get during the day is lunch. And it's in the schools that I go to as part of a project that I do for my fraternity, which is giving books to kids. We visit the schools and we read to the kids, and what we found is that we can't give the books to schools where the population is not on food stamps or on subsistence in a percentage of 90% or 80 or 90%. So all of these schools in the Baton Rouge area needed to get back open so the kids could get something to eat. Schools were closed for several weeks, as I said. Counselors reported to me that the kids now were fearful of rain because they were afraid the flood was going to return. Later on in 2017, an article in The Advocate, which is our paper, talks about the rise in admissions of adolescents to the psychiatric unit. Also, there was a rise in mental health issues in the emergency room, uptick over the year of about 14%. So, in essence, the issues that were present were the ones that we've already heard. There was displacement. There was temporary shelter. People are still in temporary shelters, still in trailers, still in motels. The personal story is that of a friend's son who's still living with his in-laws with his 2 small children. They're in the process of redoing their home a year and a half later. So the emotional issues are fear, anxiety, depression. It's not really stated that people have PTSD, but we know that that's what they've got. The nutritional issues I've mentioned, fear of persistent rain and returning floods, and many are still trying to repair their homes. So this is what is still going on. The children, I'm sure, are still impacted. The homes are still being repaired, and families are still disrupted. Thank you.
So we need to call this to a close, but I did want to give Dr. Aleman sort of the last word here.
Yes, I just wanted to mention, in terms of the mental health effects and the suicide, also in Puerto Rico, the last person that was reported that I have knowledge of last week that committed suicide was an 11-year-old child, hanged, which is actually something very particular that I'm interested in because a lot of people in Puerto Rico that die by suicide hang themselves. So the rates have gone way higher as well, and we're looking into how to address that. But one thing that we really need to work on with underserved populations is data. There's just no data. I think that was pictured in the slides where the maps were, and there was one map that didn't even show Puerto Rico. We're a territory of the U.S., but we're not in a lot of data. So that's something very important, and it doesn't only happen with territories. It also happens with oppressed communities in the mainland as well. And I wanted to mention that I had a lot of questions in the break about our organization. So I'm a member of the Climate Psychiatry Alliance, if you want to just look it up in Google. We're doing a lot of work with speaking about things like transformational resilience. And then the Puerto Rican nonprofit is Crear con Salud. We're in Facebook. If you type I have business cards for those of you that need it, so that you can look us up. Facebook has all of the information and a lot of pictures, since I didn't think that I had time for slides today. Thank you.
Okay, we're now getting to the part of the meeting where after lunch we're going to have breakout sessions and talk about some of the things that are going on around the country now to address climate change, address fossil fuel use, and what's happening at the state level. So we have an hour for lunch. There are box lunches. You can pick those up, sit down in the multi-purpose room and eat, or go to the lounge areas that are right along the windows and along the length of the building. The breakout sessions will be in a variety of locations. The education session, the state-oriented session, and the methane session are all on this level. And so if you go back to where the restrooms are, many of you have probably found the restrooms, and continue down that hall, you'll get to the place, the rooms, where the breakout sessions will be located. For the steering committee of the consortium that's going to be working on strategic planning, if you would pick up your lunch now and meet me at the registration desk, we're going to be going to a separate room where from now until 3 p.m., we're going to be having a meeting. So we will all be reconvening here at 3:15 in the auditorium. One of the breakout sessions, the one on education, is also here in the auditorium. So 2 are down the hall, the education session is here in the auditorium, but we will all meet back here at 3:15 for the next session of the conference. So thank you very much. We've had a really, an incredible morning. a tremendous amount to think about and to talk about, and I know that there are a lot of conversations going on already about what we're hearing, and look forward to many more. And thanks, and we'll reconvene later.
Thank you, sir. Appreciate it.